Good afternoon, everyone. Today we are going to start with the examination and diagnosis in fixed partial denture. This is the first topic. Okay, let's just see. If you have any problem, you can raise your hand. Okay. Unnecessarily don't raise your hand. It is quite difficult to concentrate on the teaching purpose when you are presenting any lecture. Okay. If you have any problem, you can chat it, you can text your message. Okay. Don't unnecessarily raise your hand. If you raise your hand, I'll discontinue the topic. I'll declare the topic as completed. Okay. So today's topic is examination and diagnosis in fixed partial denture. Basically, one second. So these are the contents for your topic. The first one is the effect of tooth loss. What is the basic effect of your tooth loss on the fixed partial denture prosthesis and the mouth the patient is having, the reasons for the tooth replacement, indications and contraindications, the diagnosis part in total, then the clinical examination, radiographic examination, and all the various type of treatment planning depending on the bridges, very different type of context, margin placements, and the biologic width. The occlusion, aesthetics, and the endodontic consideration will be considered at the end. So these are the content for today's topic. Okay. So the introduction includes the first one. So basically, what is the diagnosis? It is the basic determination of your any nature of your disease. So if you want to diagnose it, you should know the determination. You should know the process of the disease basically. Okay. In fixed partial denture, we have basically three parts, the three components of your fixed partial denture. The first one is your pontic, the second one is your retainer, and the third one is your connector, which connects all the parts together. So these are the retainers. So this is the pontic, and the which one which is connecting your retainer and pontic is your connector. This is the abutment tooth. The prepared tooth is called as abutment tooth. So what is the effect of tooth loss? Basically, if you see many patients when you do in any OPD, basically the patient is having a missing tooth for a long period of time. The drifting of the teeth occurs. Basically, if the location of the teeth is here, the teeth tend to drift here. Okay. It moves from one side to the other side. Okay. It depends upon the age and the periodontal condition of the patient. The tooth movement basically depends upon the opposing tooth. If it is present, it doesn't move. If it doesn't have any contact in the opposing tooth, it will tend to move. Okay. If you don't have any tooth anterior and the posterior, the most probably the tooth will go down and the right side. So there is an effect of over eruption or the opposing tooth. So basically the first one is your loss of bony support for the tooth. Okay. If there is supra eruption or the over eruption of opposing tooth, so basically that will be the loss of your bony support for the same tooth. There can be an overgrowth of the alveolus also. You can see here there is an overgrowth of the alveolus can be seen if the patient doesn't have any opposing tooth. You can have the traumatic occlusion. You can see it here also and here also. Okay, you can see the trauma, the occlusion, which will lead to the loss of contact also, which will lead to the food accumulation or the food impaction. Periodontal breakdown is the consequences of the same, and there will be a subgingival caries. As the tooth drifts downwards, this part of the tooth will get exposed, and then you will have the plaque accumulation and plaque accumulation in the same area. So what are the reasons for the treating any tooth loss? The first and the foremost reason is the aesthetics. Okay, if you want to replace any tooth, that is the first criteria for that is your aesthetics. You should change the aesthetic of the patient. This is not acceptable. Okay. That's why patient come to you to replace the same teeth, the lost teeth or the decayed teeth. The next one is the function. If the patient's functions are not restored, then it is waste of money and time also. So if the patient is having any pain in the TMJ, that is the one of the good reason to treat any tooth loss. The speech comes next and the maintenance of the dental health. So these are the reasons for treating any tooth loss problems. So what are the indications for your fixed partial denture? The first indication is the short span edentulous arches. Whenever you are going to give a fixed partial denture, always it is preferred that it has a short span of edentulous arch. If it is a long span of edentulous arch, we prefer removable partial denture in your case. Basically, when you go with the sound teeth, the presence of sound teeth that can offer sufficient support to the adjacent tooth and the edentulous spaces. So whenever we go with the indications, the first and the foremost thing is the patient's preferences. With the patient on fixed teeth, you have to make sure that you are giving him a fixed tooth. Otherwise, your patient will be not happy with your prosthesis. In cases of mentally compromised patient, we don't advocate any removable partial denture. It is always good to give a patient fixed partial denture. So what are the contraindications? The first contraindication for the fixed partial denture is whenever you see the large defect like this or the bone loss of the tooth. You can see it in the first diagram. See this diagram. Okay. There is a large amount of bone loss is present due to trauma. Okay. So in this case, it is always preferred to go with the replacement of the tooth using implants. Bone grafting materials can be used to graft the bone first and replace the teeth with the help of implants also. Removable partial denture also can be used. Okay. Whenever the patient is very young, in very young patients, we don't go for a fixed partial denture or crowns. We wait for the patient's growth to take place completely. Then afterwards, only we can proceed with the fixed partial denture. Because the younger patient will be having a large curved chamber. The younger patient should be having a large curved chamber when compared to your older patients. The contraindications include long span of edentulous arches. When the patient is having bilateral edentulous arches, the class 1 and the class 2 cases for your Kennedys. In such patients, we always prefer to have a removable partial denture given to the patient. So, the congenitally malformed teeth should be always replaced with the proper cosmetic purposes. Otherwise, it will have a aesthetic effect or the effect of the function will take place. Mentally retarded patients, we don't give it. The medically compromised patient, we try to avoid the fixed partial dentures in those patients when the patient is having uncontrolled diabetes. Very old patients, we don't prefer to give a fixed partial denture. So the basic diagnosis and so the examination and the diagnosis, we first start with the chief complaint. So basically, when you record your chief complaint, you make sure that you are recording preferably in the patient's own words. The chief complaint should include following categories. The first one will be your comfort. It can be basically again divided into three categories. The first one is pain, sensitivity, and the swelling of the same. Okay, these criteria should be evaluated properly. Functions also. The social stigma of the patient should be entered into your case history. The personal details also you have to enter it. That can be a patient's name, address, phone number, sex, occupation, and the work schedule and the financial status if it is given by the patient. So we in detail record the medical history of the patient. It is similar to your other case history performers. Okay. The systemic conditions we make sure that you are taking the proper medical history for the patients. Okay. That can cause the various drugs which can cause periodontitis. So that should be modified according to the physician's concern. Okay. The diseases which can control the parental conditions that can be because of your diabetic tablets and then menopause, the pregnancy, the anticonception. These are the drugs basically it will interfere with the systemic conditions. So make sure that you are having a proper medical history taken prior to your fixed partial denture operations. Then the dental history, it includes the periodontal history, restorative history, and the endodontic history of the patient. Orthodontic history, if the patient is undergoing any orthopedic treatment, it should be properly written. So the patient's earlier oral surgical procedures should be entered in your prosthetic case histories. Then the radiographic history of the patient should be evaluated. We should make sure that the patient's TMD dysfunction history should be properly recorded. If the patient is having any discomfort, tenderness, palpitation, seen on the TMJ of the patient. In such cases, we first treat that TMJ dysfunction, then only we can proceed with the fixed partial dentures. So in clinical examinations, we start with the extraoral examination. That is the head and neck examination. We always go with the evaluation of size, shape, and the symmetry of the face. After that, we check the profile of the patient. Then all the cervical, all the lymph nodes of the patient will be palpated. All the palpation of the lymph nodes will start with the TMG evaluation and the checking of the muscles for the mastication for any dysfunction, and the discomfort can be evaluated. So these are the various methods to check the TMG. And we have to stand behind the patient. Okay. That can be done by various methods. So we can check the muscles by palpating it properly. All the muscles of mastication that should be palpated. You can see the lips. The competency of the lips should be evaluated. The lip line should be evaluated. The smile line should be evaluated properly. When you come to the intraoral exam, it is the basic part. So we should have to take it very seriously. In occlusal examination, we start with the initial tooth contact. Okay. Which tooth are in contact when the patient is closing the mouth. The second one is the general alignment. The last and the second last is your lateral and protrusive contacts. When the patient is moving his mandible to the right or to the left. In such cases, we have to evaluate any disclusion, posterior disclusion, any contacts on the working and non-working sides. You can check for the fremitus. Fremitus test can be done in the anterior teeth. You can check for the jaw malleability. So the one of the important part is your parental evaluation. We check the parental evaluation by following steps. The first one is your gingival evaluation. We check for the tooth mobility, malposition of the tooth, open and deficient contacts. Okay, any missing or the impacted tooth present, areas of the inadequate and the attached keratinized gingiva. If it is inadequate, we don't start with the fixed partial denture. We have to correct the parental condition of the patient, and then we have to start it again. Okay, so these are the parental evaluation. You can check the clinical attachment level or the attachment level of the parental. Okay, it basically determines the amount of parental destruction that is being occurred. So basically, if you have any parental destruction, okay, the loss of if your parental goes down, so we have to make sure that we have check it properly. And can we check the depth of clinical attachment level? For that, we have the graded type of probe which we use in the parental examination of the patient. Okay, first we have to check the probing depth of the gingival sulcus, and a fixed reference point should be marked on the tooth surface. So we have to measure the distance from the CEJ. Okay. Again, we have the charting for the occlusal conditions and the parental ligament also. We can individually do the charting for individual tooth surface. Both can be done. So we have a very famous classification given by the Siebert. Okay. Siebert has given this classification depending upon the deformity of the ridge. Okay, we classify these categories into class 1, class 2, and class 3. And there is another class which is called as class 1, that is normal. When we have the ideal kind of ridge present, facial-lingually also, and the buccal-lingually also. Sorry, facial-lingually also, and the mesodistally also. So in class 1, we have the facial-lingual loss of the ridge. The loss of the ridge is basically present on the facial and the lingual aspect of your sorry. The loss of the facial lingual ridge can be seen in compared to the width. Now there will be a normal apicocoronal height. When we see the height of the ridge is similar, just the length, sorry, just the width of the ridge is very less. In class 2, basically we have the reduced height with the normal width. The width of the height, your ridge is normal. In class 3, basically we have the shorter height of the ridge also and the width of the ridge also. The height and the width of the ridge changes in class 1, class 2, and class 3. In class 1, basically we have the buccal width of your ridge is lost. In class 2, we will have the loss of height. In class 3, we have the loss of both height and width also. So, what is the importance of the diagnostic cast in the fixed partial denture? Okay, we can properly evaluate the crown length and the morphology of the crown. We can check for the crown alignment. If it is necessary, we can proceed with the same thing. The path of insertion should be evaluated properly. The available pontic space can be measured on the diagnostic cast. You can check the occlusion of the cast on the articulator if you articulate the cast on the on the articulator. You can check the soft tissue contours, and you have to, if you want to modify it, you can go for any pre-prosthetic surgeries. So if there is any presence of any body contours that can be a tori or any exhaustion is present in between the two, that can be removed prior to the prosthetic procedures. We can check the evaluate the aesthetic factors also. So this is the importance of your diagnostic test. This is one of the SAQ in your examination. So radiographic examinations is one of the SAQ